All right. Hello, everyone, and good evening. Thank you for taking the time out of your night to come join me. We're going to be talking about some common sports injuries, how to prevent them, how to treat them. I've kind of taken a sampling from some of the most recent patients that I've seen to try and talk about what is most likely going to come up. But if you have any questions, either during the presentation or after the presentation, feel free to type it into the chat and we'll try to address those as soon as we can. My name is Mike Nieto. I'm a primary care sports medicine doctor with Hoag Orthopedics and Orthopedic Specialty Institute. So I'll kind of give you an overview of where we're headed tonight. We'll talk about some shoulder injuries, elbow injuries, and then wrap up with concussion. We're seeing a lot of concussion as kids start to get more involved in sports, coming back from the COVID break. So we'll kind of touch on that. And again, if you have any questions throughout any of the presentation, feel free to put it in the chat and we'll address them. So starting with shoulder injuries, if you can take a look down at the x-ray on the picture on the bottom, it's showing the growth plate of the arm bone. We're seeing a lot of overuse injuries in kids. So the difference between kids and adults, someone like me, is that kids have growth plates, which are the weak spots in their arms. And so anytime a kid has what we call long bone pain, and there's pain at the end or at the end of the bone, to me as a primary care sports medicine doctor, that's a growth plate or overuse injury until proven otherwise. And if you focus on the picture in the top right, it's showing a anatomical model of the shoulder, showing the rotator cuff muscles. There's 4 rotator cuff muscles. The supraspinatus muscle, which is the top muscle on the left-hand side, is the most commonly injured rotator cuff muscle, causing a lot of pain with movements like external rotation and moving your arm away from your body. We're also seeing a lot of labrum injuries. That's the small picture here in the top. That's a cartilage ring that's surrounding the shoulder joint. And people often will describe a vague, deep anterior shoulder pain as a way of portraying their labrum injury. So here are some of the risk factors, especially in youth and baseball players for shoulder injuries, and then we'll move on to how to prevent these injuries. So I would say first and foremost, incorrect throwing motion is the most common risk factor that we see. Throwing too many innings is also seen very commonly, and it kind of goes to the last bullet point here. When kids are throwing on multiple travel teams or a high school team and a travel team, you know, the coaches aren't able to keep track of their innings and pitch counts, which account for a big risk factor in the shoulder injuries. I think one thing that goes missed a lot is not only a true pitch count during the games that they're throwing, but really taking into account pitches thrown between innings and warm-ups, before games, in between games. A lot of kids are having, you know, double headers twice a weekend, and so they're throwing quite a bit that's not accounted for, and those all play into the risk of having shoulder injuries later on. Not taking a break during the year. I see this with most shoulder injuries. We recommend 2 months following a season, and then sporadically throughout the year, a month here and a month there. I find this to be the most difficult break for them to have, is mainly the 2-month period, because again, going back to players being on multiple teams, a lot of commitments, a lot of money is given to playing in these tournaments, and I understand that. I was a baseball player myself, so I can relate to that. But I think especially in the growing athlete, we need to give them time to have them healthy going into the end of college and beyond, hopefully. And then again, when we are pitching, throwing curveballs, splitters, breaking balls too early on. A lot of research shows, you know, trying to hold back breaking balls until around 14 or 15 years old, it helped the kids skeletally mature and decrease the risk of elbow injuries and shoulder injuries. So here's an example of pitch count limitations. There's lots of different schedules depending on how old you are and how many pitches you should be throwing. If you look at kids who are 17 and 18, that's about the time that we get to around 100 pitches. When I was in college, a lot of our pitchers were stopping at 100 pitch count no matter what, and so those are kids up to 22. So you can see, kids 16, 17 years old or still aren't skeletally mature should be very careful throwing anywhere around 100 pitches per game. And then going to the next bullet point, it goes into the rest period. So if you're throwing over 66 pitches in a game, you need 4 days off between pitching outings. Around 50 to 65, 3 days, 35 to 50, 2 days, and then 20 to 35, 1 day off between pitching. How are we going to prevent these injuries? It's a lot of what I call band work. So using your rotator cuff muscles that we looked at before, again, they're 4 smaller muscles. So all of the work that we're doing with these rotator cuff muscles want to be very slow, deliberate, and controlled. If you start doing them too fast or too heavy of weights, you're going to start engaging other muscle groups that we don't want to be working. Stretching is very important. The pectoral muscle group, making sure that those are not too tight and interfering with your throwing mechanics. Very important to do shoulder or scapular stabilization. Those are all building enough stamina and a lot of core work. So abdominal, legs, and back strengthening. There's been a lot of research coming out recently showing how important core muscle strengthening and stamina is to decreasing both elbow and shoulder injuries. So we'll kind of move down the arm to both lateral and medial epicondylitis. Medial epicondylitis is also known as golfer's elbow, and probably most of you guys have heard of lateral epicondylitis or tennis elbow. These are commonly injured due to repetitive wrist flexion or wrist extension. These muscles form one common tendon that attaches either on that lateral epicondyle or medial epicondyle, and you get tearing or scarring or disorganization of that scarring that can lead to pain and injury. The reason these tend to be long-term injuries is because there's not good blood supply to those tendons. And so you get partial tearing. When we look at them either on MRI or ultrasound, we'll often see calcifications. In very rare cases, you can actually rupture these tendons if you continue to play through the pain. So how are we going to prevent these elbow injuries? Again, you'll see a common theme here, strengthening of the forearm and wrist muscles. Going back again to the shoulder injuries, you want to be able to rotate sports and activities because, again, the lateral and medial epicondyle injuries tend to be overuse injuries. So the more that you can rotate and not play those racket sports or golf sports day after day, the less likely you are to have overuse injuries. Proper equipment, making sure either the golf club grips or the tennis grips are the right size. Making sure that the racket, it's been shown that stiffer rackets with looser strings can prevent elbow injuries. So that's one thing to either talk with your coach or local racket stringer about as well. And again, proper technique, talking with your coach. Getting a coach if you don't have one, if you are experiencing a lot of elbow pain, they should be able to help you with your technique. How are we going to prevent and treat the elbow injuries? Rest. So, a lot of the times taking a break for 2 to 4 weeks can help people pretty significantly. In my experience, it's usually more on the 4-week mark that these elbow injuries start to improve. You can see from the model here in the picture that the elbow strap, it releases some of the tension in those common tendons and can help with elbow pain. We often will use medications like the NSAID medications, which is Advil, ibuprofen, naproxen, sometimes prescription strength medications, as well as Tylenol that can treat these injuries. Physical therapy, again, strengthening both the elbow, arm, and wrist muscles can help with the lateral and medial epicondylitis. Icing. I find what's easy for areas like the elbow is getting a Dixie cup, freezing it, And so then you can take the ice and then kind of really target the spots that are causing you pain. And as that ice starts to melt, you just peel back the Dixie cup, and that does tend to work well for things like elbow injuries. And in refractory cases, or people who just continue to get elbow pain despite taking breaks, using anti-inflammatory medications, and doing all the proper physical therapy, we do things like PRP, which is plasma-rich platelets, where we would take the patient's blood, we centrifuge it, and that concentrates all the growth factors and healing properties of our own blood, and we would, under ultrasound guidance, inject it into the areas of tearing or calcifications. The last thing that I wanted to touch on before opening up to the questions is concussion. I'm seeing probably at least 1 to 2 new concussions a day in my clinics, so I wanted to touch on it briefly. As parents or coaches, your main job is to really recognize the symptoms rather than knowing how to treat it. Once you do recognize those symptoms, bringing them into a medical provider, whether it's an advanced practitioner or medical doctor who deals with a lot of concussion, is very important. A lot of the times the primary care doctors know how to get the concussion treatment started, but they aren't familiar with long-term treatment in dealing with these concussion injuries. So yes, concussion is a type of traumatic brain injury. Typically, due to direct force to the head or neck or even the body, as you can see the kid in the upper picture getting hit in the head. But it can also occur with rotational forces, such as like whiplash during a car accident or even a bad injury on the field. A lot of people think that you have to lose consciousness for a concussion to occur, and actually it's very rare. The research shows 1 in 10 concussions result in a loss of consciousness. In my experience, I would say it's much less than that. And then 2 kind of target groups that we really have to keep our eyes on are young kids. Research shows that those go unnoticed the most. And then older kids, kind of the kids that we've been talking about, as they're on multiple travel teams, and they know the importance of whether it's looking good for colleges or beyond, is that they're not going to report these symptoms enough. And we'll talk about why it's so important to keep your eyes out and watch for these concussion symptoms. So we have a question here. Do massage work as an effective treatment for elbow, forearm tightness, and injury? Yes, I would say they definitely do help. I always call it the kind of the poor man's PRP, is really digging into those common tendons that we have and trying to bring any blood or inflammation to that area. I often do that to myself a lot, is kind of digging into those tendons. So I'd say yes, that is a great way to start down the road of recovery for those lateral or medial epicondylitis. And one more question. How would you recommend speaking to the coaches regarding pitch count limits? I think it'd be important to maybe visit with a sports medicine doctor or someone that's familiar with pitch counts and getting some good recommendations in writing. I'll often print these pitch counts out so the parents can give to the coaches to talk about it. But I think for the most part, by and large, coaches are really good with pitch counts. But I think as parents, it really comes down to your responsibility, right? These are our children. We can't allow the coaches to dictate what our children are doing. We really need to take responsibility into our own hands. And if your son or someone is having arm pain, we need to take them out, have them be seen and cleared by a medical doctor rather than having them pitch through the pain. And then, does weightlifting help prevent injury? Yeah, I would say absolutely. There's a big stigma, I would say, around weightlifting with children. All the research shows is, having children being monitored and watched by someone who knows what they're doing is really the most important thing. And for the most part, there's really low risk. It tends to come up a lot about questions about growth plate injuries in weightlifting. And, if they're getting watched closely by someone who's experienced in weightlifting and knows what they're talking about, the risk is significantly or very, very low that injury will occur. So I would encourage weightlifting, really starting with body weight type lifts and progressing as they get through the high school age of more weightlifting. Okay, and continuing with concussion. So we'll kind of go over some common concussion symptoms and then talk about less common that we see a lot in the clinic. Headache, head pain. A lot of kids will describe head pressure, so they don't always say pain, it's pressure. You got to be specific with some kids. Nausea, vomiting. I would say vomiting tends to be somewhat rare as well, but nausea is very common. Dizziness, changes in vision. A lot of kids will have sensitivity to light and noise. A lot of kids end up wearing sunglasses in classrooms and everywhere they go because of the light sensitivity. And then a lot of kids will just describe saying that they feel brain fog, slow down, difficulty concentrating. You know, they feel fine, they start to read or do an assignment online, and they really have a lot of difficulty either completing the assignment or with concussion symptoms, typically the head pressure. And some less common symptoms that I would say the public knows, but we see quite often in our clinics, are difficulty with sleep. You know, that's something I would say is probably the number one treatment for concussion is deep, prolonged sleep. So if kids have trouble with initiation of sleep or falling asleep or staying asleep, it's something that we treat quite aggressively in our clinics. Emotional instability or irritation. A lot of these kids tend to have a underlying emotional difficulties, and concussion can definitely bring these symptoms out, and so they're a lot more severe. And that's the same with being sad, nervous, or anxious. Some kids tend to have a baseline anxious nature with them, and having a concussion makes those symptoms worse. So depending if it's ADHD, anxiety, often will make alterations to medications for short periods around the concussion event. So this is what I would say is really the crux of parents or coaches, is the recognition of concussion. So first and foremost, we're going to remove those athletes from the game. They should not be returning to the game, that game specifically, and until they've been cleared by a medical provider who, again, is comfortable and has treated a lot of concussions in their career. Because a lot of these symptoms tend to be a little bit nuanced, and so we want to make sure that we're not missing something, because it does put them at risk for something called second impact syndrome when they get another second impact concussion type injury that can prolong the symptoms. And again, if anything is seriously expected, whether it's a big fall or a big collision, if there's any concern, call the paramedics. They can come with things like cervical spine collars, boards to load the players onto and get them cleared medically. You don't want to move anyone who you suspect has a large neck injury or concussion if you're really worried about them. So here are some of the warning signs that maybe we need to call the ambulance or have someone be seen sooner than later. Pain in the midline of the spine, that could indicate that there's a fracture. Radiating pain into the arms or legs, that can be seen with nerve irritation. So there's small exits out of the cervical spine where the nerves leave the spinal cord that control in the neck, the upper extremity. So if you're having pain radiating down into both arms or legs, that would be a warning sign that there could be something additional beyond a concussion going on. This one's a little bit nuanced, worsening or progressive headache. So a lot of kids, again, are going to have headaches or head pressure with concussion, but if the headache continues to escalate, and sometimes they'll say the worst headache of their life, that would be a reason to get them checked out in an emergency room situation. Loss of consciousness. This can go with just, a concussion, or it can go with some closed head injury that's worse, including a brain bleed. Deterioration, or someone that's worsening, they're getting violent, agitated, wanting to fight what parents or coaches are asking, that would be a reason to really keep an eye on them. And then vomiting multiple times is also another warning sign. The screen, oh, awesome, thank you. So how are we diagnosing concussion? There's not imaging or a blood test. No CT or MRI is really going to diagnose a true concussion. It's going to be that experienced provider listening, taking physical exam signs from the patient and really putting the whole picture together. And again, more extreme injuries that we talked about earlier, don't hesitate to either call in the ambulance, have them cleared. We always have time to take a break from the game, make sure the kids are safe is really the number one thing that we're looking for here. Treatment, and I would say this is it varies from player to player, athlete to athlete. A lot goes into it. I see athletes who have multiple injuries at the same time. They come out with, snowboarding injuries where they have broken bones, or, at the same time they had their concussion, they twisted their knee, which led to them hitting their head, and so they have ACL injuries, other injuries that go along with concussion. And I find, the more severe secondary injuries there are in relation to the concussion, the longer their symptoms are going to last. Again, the second bullet point, very important, remaining off sports until the symptoms resolve. We'll go through the return to play protocol here in the next slide to kind of talk about what we do once the symptoms are resolved and how we get them safely returning to sports. Often kids will take time away from school. 10, 15 years ago, the concussion treatment was take the kid, put him in a dark room, no TV, no physical activity. And a lot of those things still kind of remain as treatments, but what we've really found in the last 10, 15 years is that getting the kids up and moving within reason. So I always like to have kids, as tolerated, taking short walks throughout the neighborhood, or often have them going on a stationary bike if they have access to it, cranking that resistance down to zero. I tell them it's not a race, it's really just getting the feet moving, the blood moving throughout the body. And that has been shown to decrease the recovery time from a concussion. And that's kind of the last bullet point there. So let's walk through a return to play protocol. So step one, back to regular activities. These kids are in school full time. It's been a little bit tricky this last year with the hybrid learning. Some kids are in school, some are out of school, only doing computer. So the computer learning has thrown a little wrench in everything, just because it's been difficult, because a lot of the kids who have concussion have difficulty focusing on screens. So trying to get those kids back in a timely manner has been interesting this year. We start them out next on light aerobic activity. That's, again, the walking around the neighborhood, the exercise bike, starting around 10 minutes. And what I tell them is, if you can go 10 minutes, the next day go 13 to 15 minutes and slowly increase until I follow up with them, usually within a week. If they get symptoms at 12 minutes, I tell them the following day only go to 10 minutes, and kind of as tolerated, it's really an art form on the patient and parents aspect, because it's a moving target. There's no concrete treatments really with concussion. I don't think I've ever had two patients with the exact same treatment. Everything is always taken into account the mechanism, the individual person, their past medical history, and how they're progressing. And then we move down to what we call heavy non-contact activity. So we start getting them out in the track, sprinting, running, doing soccer drills, taking ground balls in a controlled environment, not really batting practice, because again, we don't want them to get hit again. We talked about their hand-eye coordination gets off a little bit too, so that's important that it's really controlled at each step. And the goal would be to move slowly, to not go backwards once we start the return to play protocol, but it does happen quite a bit that we do have to take a day or two and start over. And then we get the athletes into a full practice or scrimmage, and so there's still not all that pressure for the kids to compete. And if all those stages are passed, they're not getting reproduction of their concussion symptoms, we allow them to start competition again. I think I have one more question, then we'll open it up. Is there a concussion limit? My concern is long-term effects. So I would say no, there's not a concussion limit. I do get that question quite a bit in clinic. As kids get multiple concussions, it tends to be, it's not always exact, but the recovery time tends to be longer and longer with each concussion, I would say, in my experience. So that, again, is some deep discussion, lengthy discussion that I tend to have with players as their concussions start to add up. I think thankfully as you start to get around 4, if not more concussions, parents, athletes, and doctors tend to all, I would say, come to the same agreement that, hey, maybe we need to try something different or take a different approach to what you're doing, because overall it's getting more burdensome on their life, and it can be dangerous too, because I would say the concussions can tend to come a little bit easier as time comes on. So is there any additional questions in the chat room? Or that's it. All right. Well, thank you guys for your time. Don't hesitate to contact your sports medicine doctor if you have any further questions.